I've been running ever since. It's been a long, long time coming, but I know change gonna come. Yes, it will. It's been too, but I don't know what's bad. Beyond this, it's been a long time coming, but I know change gonna come. Oh, yes, it will. And I, somebody keep telling me. All right, all right, all right. Welcome everyone. Welcome to our weekly blog chat. It's good seeing everyone. We're gonna, yes, you know, we always start off with a good tune. I wanted to play this, celebrating Black History Month. I see Mrs. Woods back there. She just kind of grooved into this song. And I thought about you, Mrs. Woods, when I picked this selection of it. Change is gonna come. Sam Cooke with a great song. It's good to see everyone on our weekly blog chat. I'm just happy to see everyone here. We are still waiting for people to log on in. Give us a few seconds and we're gonna go ahead and start. We have a great speaker here. I'll introduce her in a few, but you are in for a treat. And we have some updates on what we're doing within the city, different organizations and different things happening within the city. Those who don't know, my name is Oswaldo Mestri, and I am the Director of Citizen Services and the city's Chief Service Officer. It's glad to be around. Happy Friday to everyone. Let's hang out for a quick second. It's been a long time coming, but I know change won't come. All right, listen, thank you everyone. Happy Friday, and happy Black History Month. We are starting off not just our month in terms of a series of different speakers that's going to be speaking about the diaspora or the different aspects of what's going on within the African American community. And I'm pleased that we have a great speaker today, someone that I know in a good way. Very proud of this young lady and the work that she's been able to do, not just in the city of Buffalo, but worldwide, to be quite honest. And she'll explain a little bit about that. I'll talk a little bit about that too. But what a week that we've had in terms of Buffalo, a lot of different things. We're going to this maybe pause and there's actually a special prayer, one for the students at McKinley, that, whatever assistance that they may need regarding that tragic event, and all of the people that have been involved, that have been injured in some type of way. We're just gonna have us continue to keep them in prayer. Again, the opportunity when we're talking about, that's just violence, but guns, and we've talked about this with our Black chat. We've had different speakers. I want to be mindful about that. Although this has happened in Buffalo nationally, this country continues to deal with this. And so let's be ever more vigilant with our young folks, continue to talk and mentor them and be in space with them, and just be attentive with that respect too. So there has been updates on what's been going on. I know remotely that school, the Board of Ed, has a specific program and some announcements will be made shortly therein. And so I just wanted us to spend some time with that. Another event, we call it the snow event, we've been dealing with the city of Buffalo. Buffalo is no stranger to that. and we've been trying to, well, we have been diligently working with all angles, not just from the city of Buffalo. There's been volunteers that have been out there. We're going to talk a little bit about that. There's an awareness. Our commissioners attended a common council meeting to listen to residents. Whenever there's an event, we call it a snow event because there's so many different things that are happening. And they can happen multiple times throughout the year. There is the actions and the operation, and then there's the after in terms of what could we have done a little different? How can we be more attentive? And I think we are working with the mayor, working with common council members, and working with citizens and residents and moving forward. Our office within the Division of Citizen Services has the 311 caller resolutions, and I want to thank those who utilize that number. Even when we're not here, people leave messages and we follow up and we ferret and we push those calls to the various departments that are out there. We understand that the snow event that happened multiple times over the course of 2 or 3 weeks not only had to do with the amount of snow, but those who are veterans who live in Buffalo know that when the snow comes down in the morning, you shovel, or you, like me, you get a snow blower, and then you come back and you have to do that because the weather dips and it will freeze the snow. And so we salt and we do a whole host of different things. And so a lot of courageous acts from our city workers and helping out, but also from the residents in the community with that. And we're going to talk a little bit about that too. Those are a couple of different things in terms of what's going on from City Hall and from the perch that we have. We continue to listen again to residents. If you have any thoughts or concerns, share that with the Division of Citizen Services so that I can share that with the various department heads so that we can learn from the various events that we have. Again, it's good to see everyone. I'm now going to turn this over to Nicole Brown, who's going to give us a series of different updates. Then we're going to hear from my block chat speaker. Actually, no, from Nicole, and then we're going to push that over to Michael Smith, that's going to give us an update in terms of volunteer efforts. Nicole?
Welcome, everybody. I am just going to quickly share a few announcements. Please let me know when you guys can see my screen. Thank you. So as always, Stand Up Buffalo. If you or someone you know is at risk of eviction due to rental issues, the City of Buffalo has financial assistance to assist those if you meet eligibility requirements. So for more information on this, you can call 211 to learn more, as well as to apply, or you can go to standupbuffalo.com. The tenants and landlords, please sign up for the City of Buffalo's free apartment building recycling program. It helps keep the city clean and green. You can find out more about this and sign up at buffalorecycles.gov and find out more about general recycling information on that website as well. There's a Dogs to the Rescue fundraiser. This is happening Saturday, February 19th. It opens at 5:30 and is hosted at Buffalo Ironworks. So it's a family-friendly event, and kids are $3, adults $5, and families are $11. If you need a child with autism signs, this has been added to the list of roadway caution signs. Apply for this sign to warn the motorists in your neighborhood. There are eligibility requirements to be met. And if you do meet them, you can apply and call. You can call 311 or go to buffalony.gov. This summer, there is a lifeguard program running. There is a certification and training program from Monday, February 21st to Friday, February 25th. It is still open, and you can register today at buffalopal.com. There are some eligibility guidelines to meet in order to apply. And if you are actually an instructor and available to train lifeguards, you can apply as well at buffalopal.com. For PSA alerts, especially in regards to snow and parking, you can text Join Buff Alert to 38276, so the number has changed. And if you just want the parking updates, you can text Join Parking Updates to that same exact number. As always, every Sunday, the mayor hosts his radio show, Talk of the Town with Mayor Brown. So this Sunday, February 13th at 1 p.m., you can catch us on his Facebook. He will be live. It will be streaming live, and you can also catch it on WUFO. There's a crime prevention tree planting initiative happening this spring and fall on both east and west side of Buffalo. To find out more about this project and initiative, you can speak with the special project manager for crime prevention for the city of Buffalo, Mr. Ron Dixon. His email is listed on the screen. And if you are having trouble coping or know somebody who is having trouble coping, there is the Buffalo Police Department Behavioral Health Team that is there to help residents in crisis. They are collaborating with Endeavor Health Services to provide on-site screening, assessment, de-escalation, and diversion techniques. If you want to find out more about this and how the assistance and guidance is provided, you can call the number listed on screen, 851-9604. As always, there will be cold weather coming again, so Mayor Byron Brown urges residents to dress properly for the very cold temperatures, as well as just some tips for certain things used during the season, space heaters and fireplaces, to ensure that there are no issues that arise in the home. There is one last quarter 1 meeting with the Olmsted Community Alliance. This is for Delaware Park. And so this is happening February 16th, 6 to 7 at 84 Parkside Avenue. You can attend this via Zoom. Again, it is a quarterly meeting, so there will be more held. And this is just to build representation from every Olmsted Park district. And again, this is the Delaware district meeting. If you are looking to start a block club, the Board of Block Clubs can assist with this. You can contact them at bobcbuffalo@gmail.com. They also have their phone number listed, and they have a Facebook and Instagram, and they are very responsive on all platforms. Additionally, they will be having their in-person community meeting on February 24th at 6:30, Seneca Babcock Community Center, and they will be having a guest speaker as well as updates from Block Club leaders and the Division of Citizen Services. And for Black History Month, there are free online webinars happening. So this one centers on mental health in the Black community, breaking stigma and silence. And so there are different ones hosted every Saturday, the 5th, the 12th, the 19th, and the 26th, with different topics within this area. And you can visit this by scanning that QR code on screen or go to the website BIPOCparentvoice.org. There is the Nurturing Fathers program that is hosted Mondays and Wednesdays, February 7th through March 21st, 5 to 7. This is offered both virtually and in person and helps with parenting skills, healthy family relationships, and child development. So you can also register for this by scanning the QR code, or you can contact Terry CA at the number provided, or visit the Buffalo Prenatal and Perinatal Network's website. The Buffalo NAACP Health Committee is hosting an event, the African American Women and Reproductive Health, Menopause, and Mental Wellbeing. This is hosted on February 15th at 6 to 7:30. You can register online, and it is a Zoom event, so it's virtual. There are various speakers, as you can see, and then the first 10 people to register and attend will receive a prize. And so for more information, you can visit or contact health@buffalo.naacp.org. Erie County Restorative Justice Coalition is having a youth health and wellness staycation for youth ages 14 to 19. This is also hosted February 22nd through 24th. So during their break, 11 a.m. to 3 p.m. on Hurdle Avenue. It's going to feature a lot of creativity, mindfulness, movement, and different things to help promote wellness. So you can register by scanning. It is $10 to register, or you can visit ecrjc.org for more information. Community Music School is having summer camps for kids. There are various camps throughout the entire summer. So for more information, you can call the number listed on screen, visit communitymusicbuffalo.org for more information as well. And I would encourage you to register quickly if you're interested, as spaces will fill out. As always, the Northland Workforce Training Center is offering hands-on training opportunities still in welding technology, electrical construction, and more, as well as providing services such as career coaching, financial aid, counseling, tuition assistance, and more. You can find out more about what they're offering at northlandwtc.org and apply online as well. And there is still the West Side Promise and Neighborhood Change Leadership Program. This runs March 2nd through 18th. The application deadline was January, but you can still inquire about applying and possibly be accepted. You can apply at www.ccebuffalostate.edu or reach out to Buffalo State to find out more about this program. As always, COVID is relevant, so we still have our COVID-19 testing website up at covid19buffalony.gov. You can find it about testing and vaccine locations and much more information pertaining to COVID, as well as those who might need emotional support throughout this season. There is the Buffalo Urban League's New York Project Hope, Coping with COVID. It is an emotional support hotline you can call Monday through Saturday, 8 to 7, or email projecthope@buffalourbanleague.org, and it is free, anonymous, and confidential. Their urban friendly practice is also having COVID-19 rapid testing, vaccines, and boosters available Tuesday, February 15th, 10 to 2. They have it for 5-year-old and up, and it is located at Lincoln Memorial United Methodist Church. You have to pre-register, so you can call this number listed on screen. And last, we do have the social media. As always, please follow us at the Division of Citizen Services on Facebook at Buffalo Citizen Services. And we also have our 311 page, so 311 Call and Response Center at Buffalo 311. And as always, if you do not follow the mayor, please follow Mayor Byron Brown at Mayor Byron Brown on Facebook and Mayor Byron Brown 716 on Instagram. And at this time, I am going to bring on my colleague, Michael Smith, the coordinator for the Save Our Streets program.
Thank you, Nicole. As my colleague just mentioned, my name is Michael Smith. I'm the Save Our Streets program coordinator. And I'm just going to talk briefly about our Good Neighbors Network. I'm sure some of you who I know are veterans of this network have seen the Good Neighbors Network tags, which began back when COVID first came. And the purpose of it was for dedicated volunteers in the city to check on their most vulnerable neighbors. And essentially, that's what we're still doing with this, incredible snowfall we've had over these past few weeks. We've been seeing that a lot of our vulnerable residents, our elderly, our disabled residents of Buffalo are unable to, clear out their driveway, clear out the front of their house. And what we've done is we've been collecting volunteers with who have the capacity and are willing to, help these residents facilitate so they can get access to the services they need. And I'm happy to say, next slide, please, Nicole. I'm happy to say that we've been very successful in that initiative with over 100 properties served, but we are still looking for, more volunteers. Nicole, if you could hit the next slide, please. Thank you. And that brings us here to the next slide. If you are interested in volunteering, you can go ahead and scan that QR code. It'll take you to a form in which you can fill out, give the information. We'll add you to the list, or the volunteer to the list, at which point we'll contact them with some assignments. Of course, keep a record of what they've been doing so we can give them accurate recognition for their service for the city of Buffalo. And again, as I've mentioned, all of this has been shared online on our social media sites. Next slide, please, Nicole. And that brings me to our amazing volunteers. Thank you for the awesome work you've been doing. As the director mentioned at the beginning of this call, it hasn't been easy. There is, the snow will it'll melt slightly, and then it'll freeze in the temperature, and then it becomes a whole separate endeavor just to get it cleared out of people's driveways. And our volunteers have been working hard to make sure this is done. I think in the future I'm going to include some before pictures just so you can see the amount of work they've done in removing that snow. Just again, thank you to everyone who's been a part and everyone who's willing to be a part of this. And the next slide, please, Nicole. And lastly, if you have any questions about the initiative, if you have any questions about community service hours, anything like that, please don't hesitate to reach out to myself at mcasmith@buffalony.gov. I'm, very responsive on my email. I'll get back to you quickly, and we can discuss the initiative, how you can help. If if you have any ideas, we're always open. The director has always mentioned that more people at the table is better. Diversity of ideas is good, and that's a belief that I hold as well. And with that, I'll pass it to the director. Thank you for your time, everybody.
Michael, thank you. And Nicole, thank you for that update. And we will share that information with block clubs. We do this block chat. Forgive me, I am in City Hall and there is a bit of a protest that's out regarding anti-vaxxers. And many of you know my office is right in front of there. So we're going to push through this in that respect too. But we will share that information with everyone here. And let me say, our efforts in terms of volunteerism, we're just leaning in. We know that there are many other groups that are doing this. It really makes Buffalo what it is in terms of stepping in and following each other's lead. As you know, we have the Call and Resolution Center, and we have folks who will call and my staff, we were just thinking, what are ways that we can try to help and kind of just be in this space in terms of just working with senior citizens, handicapped, and those who are in the disabled community. So that's what our event was in terms of helping out. Again, we do this block chat with our good partners with the Board of Block Clubs and Debbie Lombardo, who is the president, to get an opportunity to speak a little later on, a representative from the Board of Block Clubs as well. Let me introduce our speaker, somebody that I call a good friend and somebody that I'm just extremely proud in terms of the work and the spaces that she's been into. I knew her way back when, which wasn't too far back, but just the work, and I saw the potential in her and how she looked at the world with eyes wide open. And so the fact of the matter here is that she has benefited not only from the city of Buffalo being and working within the Division of Citizen Services, I can say that proudly. But in the places that she's been, in the spaces she's been able to make a difference, both professionally and also just helping others in terms of her work. She'll be speaking about work that affects issues in terms of our diversity, equity, and inclusion, but more specifically about our theme. This one is Black History Month. We are, in terms of America, this mosaic that is made up of so many different folk, which makes the stew of who we are so great. And so I am going to now introduce my colleague, my good friend, and somebody that I've known, Ekua, Mends, Aidoo.
Hi, and good afternoon, everyone. Thank you for that welcome. I see a lot of familiar faces, which is exciting. Miss Ada, I see you. I haven't seen you in a while, so it's good to see your face. And Oz, it's good to see that you're continuing the legacy of, positioning your staff, who's young, who's diverse, and I'm really excited to be here. So I'm going to share my screen. I have a little bit of a presentation, and actually before I do that, I'd be remiss not to mention just how much, the city of Buffalo, specifically the citizen services and the work that I was able to do in the past has really set a really great foundation for myself. Working with Oz and team, I was really able to dive into Buffalo. I'm actually from Syracuse, New York. I came to Buffalo for school and never left. But it was something really special about grounding myself in community and meeting people who actually lived in Buffalo. And it gave me a love for Buffalo. I didn't think that I would still be here after all these years. I've been in Buffalo since 2004. But it was a love of the people that I met through my interactions within the Division of Citizen Services, the block clubs specifically, grounded me in making a decision to stay as long as I have. So it's great to see you all. I'm really honored to be here and get back to the roots because this is exactly where I started in terms of my professional career. So wanted to shout that out first, and then I'll just jump right into my presentation. All right, let's see. Can y'all see this? Yes, okay, good. All right, let me just start. So I'm going to talk a little bit about cultural humility and social determinants of health, but I also want to just give a little bit of background around what I do on a day-to-day basis as well. Let me just make sure I got this situated. All right, I think I do. So I work currently for Evergreen Health. I've been here for about 5.5 years now, which flew really by. I'm the Chief People and Diversity Officer here, and I focus on a lot of different issues, specifically health equity, our people and our culture, and what makes us unique in that sense. Just to give you some background in terms of the mission statements of Evergreen Health, we are a FQHC lookalike, which is a federally health qualified center. And we foster healthy communities by providing medical, behavioral, and supportive services specifically to individuals and families in Western New York, and especially those who are living with chronic illness or are underserved by the current healthcare system. We also have two affiliate organizations. One of them is the Pride Center of Western New York, and the other is Community Access Services, which specializes in communities of color, going out and engaging with folks and making sure that we're linking people to care. In terms of our vision, we really have this large vision. It's a large goal of ours. It's a future that all Western New Yorkers has access to affordable healthcare in an environment that's inclusive, compassionate, respectful, and judgment-free. It honors diversity and life experiences, and it empowers clients to lead healthier and happier lives as well. And so just to give you a little bit of background in terms of our core values, this is really how we operate. We welcome everyone. We want everyone to feel welcome when they enter the doors that we operate in. We celebrate diversity. We are authentic and down to earth. We collaborate with our clients, and we use a harm reduction model, which makes us or allows us to celebrate all success. And we respect everyone's life experiences and don't judge. And just to give you a little bit of background around harm reduction, it's really based in non-judgmental care. People can come here. Healthcare is really, it's personal, right? It's an intimate thing. And so we want to make sure that we create this environment that everyone has, ability to come into healthcare and talk about what's going on in their life without feeling that judgment. So we affirm you in terms of how, you come in for care. We want to make sure that you're educated in terms of the ways that you can, increase your own care. And then we're also understanding as well. And so the director he talked a little bit about the theme of Black History Month this year, and it's Black health and wellness. We've been having a lot of conversations, both internal and external, around Black health and wellness. And so we know in 1926, Carter G. Woodson established Negro History Week. And so that moved obviously into the month, Black History Month. But one of the important things that he wanted to do was create a theme so that everyone really had a focus to talk about during that year. And so we know that the theme for 2022 is Black health and wellness and the importance of that. This theme really acknowledges the legacy of not only Black scholars and medical practitioners in Western medicine, but also the other ways that folks would really create the sense of health within themselves, whether that be birth workers and doulas, midwives, naturopaths, and herbalists throughout the whole African diaspora. But we also wanted to kind of call out, the different activities and rituals that Black communities have done to be well. And one of those things, when we talk about Black history specifically, and it's near and dear to my heart, it talks about some of the disparities that have happened in history and we continue to see, especially in healthcare. And there was a common saying back in the days that said, when white folks catch a cold, Black folks get pneumonia. And it just talked about the significance of, of the inequities in terms of how we approach care. And so I'll talk a little bit more about that in my presentation, but I did want to call that out. There's been a lot of different remedies that back in the day, Black people had to, come up with, and there's a mistrust in the medical system. And that's something that we really center our work on. How do we create that trust and how do we build trust by including people's lived experiences in the care that we have? But back when you think about the African roots, back in those days, there were a lot of different remedies that have been shown to have scientific proof and evidence that has helped people. Things like garlic and helping with heart care, things like aloe vera that's used within our communities often that helps with skin. And these have been proven throughout time to be scientific and actually help. And in the 20th century, we know that Black America was given a better shot of healthcare because back in the day, there was a lot of white-only establishments that, did not include people of color or Black people. And so it wasn't until the 20th century when the US government actually threatened to withhold Medicare payments. And so overnight, those white institutions, those white-only institutions actually flipped the switch and allowed other people to come in, and they were desegregated. And so that was actually 1964 with the passage of the Civil Rights Act. And so just to give you a little bit of background and context around this theme in terms of Black History Month. And so we'll just kind of move forward. So I love to start with shared language because, you know, we often are talking about different things and we might have something that we think about that other people aren't thinking about specifically. So when we think about some of the definitions between diversity, equity, and inclusion, I like to kind of call those out so people understand what we're talking about. So when we're talking about diversity, it's really, you know, it's people, but also perspectives, right? So when we think about people, you know, there's all different types of characteristics that make us who we are. But it's also perspectives. And a lot of organizations that talk about diversity say, hey, we want to hire, you know, people that come from different backgrounds. But when they come in, you try to, you know, make them assimilate to a specific culture. And so diversity is welcoming of all these different ideas and backgrounds. Inclusion is really when we're trying to give people power and voice. This has been done through organizational culture, but it's also, you know, when we talk about diversity, it's a fact, right? It's either there or not in terms of those characteristics, whereas inclusion is a choice. We get to decide whether we're promoting inclusive behaviors or exclusive behaviors. And then lastly, equity, it really is behind policy. How are we positioning people to succeed? How are we making sure that our policies and practices are really centered in what we're trying to accomplish? And so I love to kind of break this down a little bit because, you know, oftentimes people get these things confused, and I'm sure a lot of people have seen this before. Equality is something that a lot of folks talk about when you start to mention equity, but there's differences, right? So equality is when you give everyone the same resources no matter where their starting point is. And so if you look at the baseball game, the shortest person still can't see over the fence, even though they're given the same size box as everyone else. And so what that does is it reinforces existing inequities, whereas equity is based in optimal results. So we want to make sure that everyone has access to what they need to succeed. So the tallest person doesn't need a box because they can already see over the fence, whereas the shortest person is given two so that they can see over the fence. And so in real practice, you know, one of the things that we had to do in terms of equity, and I'll just give you an example. We used to give everyone a parking pass. I know the city can appreciate parking, right? This is always a conversation we're talking about. But we knew that not everyone had a car to drive to work. So we had to give people resources that they needed, whether that be a bike storage facility where they can lock up their bike, or whether that be a public transit pass where they can actually, you know, take public transit to get to work. And so that's equity in action, and just giving you a little bit of background and context around that word specifically. So when we talk about equity, I always read this quote. It says, when people face barriers to achieving their full potential, the loss of talent, creativity, energy, and productivity is a burden for not only those that are disadvantaged, but for communities, businesses, governments, and the economy as a whole. And that's because people aren't realizing their full potential. And so that burden is in the trillions of dollars. That's lost earnings, avoidable public expenditures, and lost economic output. And so I'm going to talk a little bit about a business case, but also the healthcare case for why we're really concerned around equity and what we're doing to make sure that that's at the top of mind as well. And so this is small, so I'll read a little bit through it. But the business case, you know, when we talk about diversity, equity, inclusion, it touches everything, right? There's the marketplace in the larger community. There's the workplace in terms of where we come to work every day, and the workforce, which is made up of, you know, the people that work at our organizations. And so in the larger community, things like legislation, regulations, and compliance, these are things that we all have to be aware of. But we also have to think about the people that we serve, the diversity of the larger public and where they're coming from. Our brand and reputation, do people trust us? Do they want to come and get their care at Evergreen Health? We think about the larger community and, you know, globalization as we start to do more work with folks. I mean, think about the people who are moving into Buffalo. We know that, you know, our census data shows that, you know, the Buffalo area has grown. A lot of that is because we have immigrants or folks that are coming from different countries, new Americans that are growing our population. In the workplace, we have to think about our company culture. We've been having a lot of conversations around this great resignation, people just wanting to leave the workforce altogether. And so we had to make sure that we're centering how we operate in one that's inclusive. And then when we think about the workforce, we know that when people are more engaged and they feel connected to the work they do, they're going to give more effort, right? And that translates to our patients as well. When they feel happy about their jobs, you know, that passes on to the patients that are coming in for care as well. There's a lot of changing demographics in America. We're going to talk a little bit about that. We know that in 2044, groups formerly seen as minorities are going to reach a majority status, and that's already happening in a lot of larger cities. By 2065, the U.S. population won't have a single ethnic or racial majority, and that's we're becoming a plurality nation. We know that the millennial generation is the most largest and racially and ethnically diverse the U.S. generation has ever known. Fastest growing groups, racial groups, are 2 or more races, and that's expected to triple in size by 2060. And then more than half of the growth of the population from 2000 to 2010 was due to the increase in the Hispanic population, and that's based on U.S. Census data. So as this stuff shifts, we really have to be aware as organizations, as governments. How do we make sure that people are connected and feel included? And one of the last things I wanted to mention is just our aging population. In 1950, the population aged 65 or older represented 8.1% of the total U.S. population, and that percentage is projected to reach 20.2% by the year 2050. So I always ask this question to folks, how might these changes impact our approaches to health? We know that with new Americans coming in, we might have to have more translation services for people to be able to connect to their care. Our marketing materials, they can't just look a certain way. When you come into our offices, whose pictures are on the walls? What pictures represent us all? These are all things that we've had to be concerned with as we think about the business case and why diversity is really important to us. And so I want to talk a little bit about health equity and what that means. When we talk about equity in general, we talked about those resources and giving people what they need, but health equity is really based in creating more fair advantages, reducing barriers among groups of people, whether those are defined socially, economically, demographically, or geographically. And when we talk about health equity, it really implies that everyone should have a fair opportunity to attain their full health potential, and no one should be disadvantaged just from achieving this potential in general. And so when we think about things like poverty, discrimination that people face on a regular basis, powerlessness, we talked a lot about power as it relates to equity as well, lack of access to good jobs, with fair pay, education, housing, safe environments within the community, and healthcare. These are all things that really make up someone's total health. And so health equity, I'd like to call out some of these statistics because people, when we talk about this, it's like, okay, well, you might not be eating well, or these are the reasons why you don't have great health, but there's a variety of different things that really make up someone's health. And so specifically, and thinking about people of color, we know that the U.S. experiences really significant, persistent health inequities and disparities. Black men and women face 40 to 57% higher hypertension rates than white women and men, respectively. We know that the death rate from things like breast cancer for Black women is 50% higher than those white women. 25% of Latinx children aged 6 to 11 are considered obese, compared to 11% for white children. Asthma prevalence, that's something that we talk a lot about, is highest amongst Black and Native American communities, and Black children have a 260% higher emergency department visit rate and a 500% higher death rate from asthma compared to white children. And then we also know that, things like diabetes is really impacted in communities of color as well. And so one of the things that has really been getting a lot of attention lately is racism and how it's recognized as a public health threat. When all things are equal, when you think about economics being equal, there's certain people of color generally, who still have worse rates as it relates to your health. And so those are avoidable. It's unjust circumstances, and it's really deeply entrenched in bias and racism. The Institute of Medicine actually put a report out there that found that even with the same insurance, socioeconomic status, and income, when comorbidities, stage of presentation, and other things are controlled for, people of color still have lower quality healthcare than their white counterparts. And I actually went to a talk last night. It was a lecture around health and the history of health. And it talked a lot about gynecological services as well. And it said that when Black women, we have really high, not only infant mortality rates, but also maternal health, right? Like Black women, it's a risk to have a child in America, even when you have money. You think about people like Serena Williams, Beyonce, there were a lot of complications that they had. Serena talked about having blood clots, and they didn't believe her when she brought it up. And she said, look, y'all got to go check. And when they did, they said, oh, wow, it actually was. And they were able to, treat her for that. And so no matter the amount of money, there's still a lot of different inequities that people are facing. But one of the things that actually stood out to me during that chat last night was the fact that when Black women go to Black providers that look like them, their rates increase 50% in terms of them having a regular birth, right? And so we know that these things are really evident in the things that we're looking at. And so I'm going to talk a little bit more about, you know, the social determinants of health, because these are all the things that make up someone's general health, right? So 20% of someone's total health comes from just being able to access care, so being able to go to a doctor. The rest of that 80% really comes from different things like socioeconomic factors, physical environment, health behaviors. So when we talk about socioeconomic factors, things like education, your job status, family and social supports, your income, and community safety play a role in that, about 40%. Your physical environment, where do you live? You know, your health behaviors, if you smoke or not, whether you drink or not, but also your diet and exercise, and your sexual activity as well. And then also, like we said, the healthcare really makes up 20%, just having access to a doctor. But one of the biggest things that, we looked at is that 50% of these things can be traced back to your zip code. So we can tell you your life expectancy just based on where you're living and your zip code. And these are some of the things that we're talking about. Environmental issues. Earlier in the introduction, we looked at how the Division of Citizen Services was helping people in the neighborhood, right? Volunteering, shoveling, and helping people out in that way. The city of good neighbors, right? These are the different ways that people have better access in terms of your community. So I think it takes all of us to really focus on this, and we're starting to see that more and more in healthcare specifically. And there's systemic issues, right? Structural and systemic issues. We know that there's a lot of costs that are associated with healthcare. And even though we pay a lot of money into our healthcare system, we don't have the greatest health outcomes as other countries that don't have as much money as us. So when we talk about race is actually a social determinant as well. And so when we're talking to our providers, we're saying, hey, it's not because this person is Black or a person of color that they have this higher incident or rate. It's because they're Black or a person of color that they're predisposed to this based on, our structural systems in our society. And so these are some of the things that we've had a focus around. COVID-19 showed a lot of that. We saw when we looked at the disproportionate rates of death in COVID-19, it was in communities of color. And this wasn't, anything specific to say that COVID-19 targeted us. It was that we were already vulnerable communities that had a lot of things that we need to focus on. And so really shed a light on that. We see that with the vaccination rates and trying to get more people vaccinated. And that's because people don't necessarily trust the healthcare system. And there's a lot of that that's entrenched in the care that we're trying to give people. So just being aware of that as a healthcare agency is something that we wanted to make sure that we highlighted as well. So when we think about some of the things that we can do, we have a primary and specialty care. We're really looking at disaggregating data. And so that's a really big word in terms of, breaking it down to make sure that we're seeing who's who and what type of care they're giving. And are we making sure that they're centered in that care? Looking at zip codes, right, in terms of different rates of diabetes and hypertension, asthma and COPD. These are all things that we're breaking down. We're looking at how do we partner with people who are in the community, people who already have a trusted sense within those relationships in the community. And so these are the things that we're thinking about in healthcare to really help us with that. One of the other big things that we're doing is looking at how we expand our core services to include things that are not just clinical. Do you need help getting rides to and fro your appointments? So transportation, housing. We have a really big housing program. And we actually have a housing unit right there on Cherry Street downtown, a 56-unit apartment building that is affordable health or affordable housing with a focus on healthcare, right? To make sure that people have access to affordable care and a quality care as well. And so there's other things like our nutrition programs. We actually have yoga instructors who will come in here and work with patients, acupuncture. We do demonstrated cooking lessons. And we also have an ethnic background in mind as well. So we know that different cultures like to eat certain things. How do you do that in a healthier function, right? We don't want to give up collard greens, but are there ways to maybe incorporate things like kale within the way that we eat as well, right? So giving people just healthier options and healthier versions of that. Financial assistance. If you can't afford different things, we'll find different ways and programs to connect you to as well. And so just making sure that the whole person is attended to. We have a big food pantry, one of the largest in the city of Buffalo at our location. So helping people with access to fresh fruits and vegetables is important to someone's overall care. So these are the different ways that we, really incorporate a comprehensive model for our healthcare, but making sure that we're looking at different disparities and how we integrate, the social determinants of health and overall healthcare for folks as well. And then one of the last things I wanted to talk about is really the cultural humility, right? A lot of times we talk about, just understanding different cultures, but cultural humility really says you got to be humble when you're helping people. And so your own bias, things that you might have had in mind, we see a lot of bias that are playing out in terms of healthcare providers as well. What is the bias? And when we look at, a historical lens, this was also talked about last night, a lot of people have just different notions of things. There was a lot of false narratives that came out that is still being looked at today. Things like, Black people having a higher pain tolerance or their skin being thicker. There are different things that have really followed healthcare, and we had to really dismantle some of these thoughts as well. A lot of what UB talked about last night was the new medical providers. If you're in med school, having a focus on health equity is really important. And just making sure that people have dignity in the care that they have, right? So all these things are centered in what we do on a regular basis. We know that it's really important as a healthcare provider to be trusted, to be able to come in here and talk about some of your most inner important things, and just make sure that people are not, they're not judged, right, when you're coming in, and that we're really partnering with you in your total health. So I said a lot, and talked about a lot. I want to make sure that I leave room for questions. I love to, if you want to come off mute and just have a conversation, I'm open to that as well. I'm gonna actually, let me see if I can stop sharing this so we can see everybody. Let's see, how do I do that?
You got it. Thank you very much.
Okay,
What tremendous information. In fact, there is a comment in
okay.
here. Ron Dixon said 50% of the social determinants of health can be tracked to someone's zip code. Where can we access this information?
There's a lot of folks that are doing work in this space. The Buffalo Center for Health Equity, they have a task force. It's like the African American Health Disparities Task Force. And so people like Pastor George Nicholas, Rita Hubbard Robinson, who is a near dear friend I know to Director Mestry, they have a lot of information that are on their website. The Partnership for Public Good has a bunch of information as well on things like zip codes and race-based factors that we see within the city of Buffalo. One of the biggest things that a lot of people are talking about from a disparity lens is this environmental component as well, right? And so the 33 that was, put right in the middle of communities of color, Black communities, really, when you think about the exhaust that's coming off these cars, people are inhaling that. So when you think about the asthma rates and how high those are, there's a lot of different environmental impacts for people of color. The Love Canal, there's a bunch of information just around how environmental factors play a role in people's care. I want to say there was one around cancer as well. And
I think there is, but even when you talk about the 33, I think there's obviously the health concerns, but also economic, where Buffalo has a commitment of business strips. And so when you cut something from one community to another, the emergence or the Fillmore Avenue, which at one point in time was bustling, Jefferson Avenue, you kind of separate communities that have been challenged by itself, just to reinforce some other types of what other people call equity. And you're going to the suburbs as a result of that too. And so
Absolutely.
I think you're right on spot with Kua. Any other questions for Kua? And Kua, you talked about, obviously, you talked about a common language, which I think is important, because I think when we want to be able to talk about this, sometimes we're talking at each other. And I think you mentioned, like, let's understand terms. Let's understand that in your business and doing this work or whatever, what do you think are misunderstood terms, or how we are either speaking at each other but we're not understanding each other?
Yeah, I think that's a great question. First and foremost, I would say the word diversity, right? Certain people hear that and they think we're talking black and white automatically, but there's so many different things that we mean, right? Ability, disability, people's sexual orientation, people's economics, some of the things that I talked a little bit about earlier that make up someone's total person, right? Your own culture and ethnicity. My background, I'm Ghanaian, I'm Black and Ghanaian in terms of where I come from. There's different connotations that come along with that as well. So when we talk about diversity, I think people automatically hear it and say, oh, here we go. We're talking about Black people again. Let's just kind of put this to the side. But the reality is, when we focus our efforts around diversity, better innovation happens, right? When you have people who are coming from different backgrounds, you can challenge each other to come up with the best ideas. And oftentimes that's not happening because we want to make sure that everyone fits in a certain, bubble, or they're coming from a certain background. And so I would say that's definitely one of the biggest misconceptions. Another one is the word equity, right? When we're talking about that, it's like, okay, we treat everybody equal. And it's like, nah, we actually don't mean that. We really mean, let's focus on what people need. So what do they need? And how do we get better at, breaking down some of those barriers so that people can access a better chance and opportunity? I think that's really important. And it's a great question, because when people hear these things, they're like, all right, here we go. Here go the Black people talking about Black issues. But there's so many things that make it up. Gender is another one of those things as well. And so I think it's important to create that shared language so that everyone is starting from that same, vision and vantage point, for sure.
Well, listen, Ekua, I want to say thank you very much. And I don't know if there's any more questions. Wanted to give our representatives from the Board of Block Clubs an opportunity to speak, but your presentation was not only timely, but spot on. I don't think we can get enough of this. I think the fact that you lean in with your work and the organization that you are representing is an important thing. I know you spoke about the organization, which is doing tremendous things, but you are as well. When you take this and take it to another level, we want to help people. I think that's the most important thing that we can be able to do. So I just want to say again, thank you very, very much on behalf of myself personally, but also the Division of Citizen Services in terms of what you've been able to present. Thank you.
And thank you, Oz. I like I said, I'd be remiss not to shout y'all out, because this is where I started, right? And so when Nicole reached out, I said, of course I would come and chat with you all, because it's near and dear to my heart. It's the work that got me started here in Buffalo. And I honestly don't think, without that, I probably wouldn't be still in Buffalo. So y'all got me. It's something that I think about often, where I'm like, all right, I think I'm going to go somewhere warmer. Director and I talk about travel all the time. And so I travel, but I come back. And I think that's the biggest thing is coming back, right? And Buffalo is home for me now. And I've been able to make a great connection with the people, and I have a love for the people. So whenever y'all call, I'll definitely be available. And
thank you very much. Listen, a part of that diversity is generational, right? And it's one of the things that keeps me personally relevant, but I think just empowering this next generation, which I call you are the generation, which is it, in terms of this decision makers. And so again, thank you very much. Thank you. Thank you. Board of Block Clubs. Listen, I appreciate each and every one of you in terms of your efforts. I know you have a meeting coming up. Listen, I'm always peeking on your Facebook page, because you guys are just relevant with the stuff that you have, in terms of putting things out. I know Debbie couldn't make it, but I didn't know if Dr. Cortasia or Linda wanted to say anything.
It was a great lecture today and talk. I really appreciated it. And I had my own experience being elderly this week with my OBGYN. My insurance company isn't going to cover annual appointments. And I'm like, well, those parts don't count anymore for me? What's the story? So these disparities run deep and throughout our whole community. And I'm glad to hear that there are agencies like yourself and people who are out there advocating for us. They have a list of criteria. One is if you have more than 5 sexual partners in your life. Well, so I got my, it's like, really? That's one of them. My sister had cancer of her uterus, and she did not apply. She did not get these, you know, could not get this coverage. So it's just crazy. So I just wanted to bring that out as a highlight of something that personally touched me this week. And hearing you speak, I said, well, maybe I should say something, because the elderly get, like, you get a certain age, you're like, they're going to die soon anyway. That's what it makes me feel like anyway, you know. And yeah, I'm wrapping my head around the fact that I'm elderly, so they're telling me I am. So anyway, thank you.
Listen,
Thank you.
thank you. Dr. Cortasia, did you want to add something?
No, not really. Just hope to see people at our meeting on the 24th at 6:30 over there on Seneca, 1168 Seneca Street. 6:30 p.m. is our general board meeting. Also, hopefully this year, with all the lifts and restrictions and different things, we will finally be able to put together our annual banquet. So put your fingers together and cross your toes, and hopefully it works out that we can get it done this year, and it'd be safe enough for all of us to get together. And thank you for a wonderful presentation, and everyone have a great day.
Good. Listen, my last comment that I want to make here, and you can see my background here, is that the next few days, you know, and I know it's commercial, and I know, you know, folks are thinking that they want to make some money off it, whatever, though. But listen, a loved one is a loved one, whether it be family or someone that you care about. You know, happy Valentine's Day to each and every one of you. We will see you next week. I'm giving you back 3 minutes of the day, of our hour. Have a beautiful, beautiful weekend. Be careful and say, look at all them hearts out here. Yay. Okay. Take care, and thank you for attending our block chat. Take care, guys.
Happy Valentine's Day, everybody.
Happy Valentine's Day. And if you don't have one, go find one.
I love you all very much. You mean a lot to me, this whole community of caring people.
We
You're
love
wonderful.
you too, Linda.
Thank
God
you,
bless
Ellen.
Thank you.
Thank you. God bless you too. Thank you.
Have a good weekend.
Be well.
Thank you, guys.
Bye.
I'm cooking my spinach.
I was wondering what that was, Linda. I can see the bag.
I'm cooking.